All right, hello everyone. Feeling almost fully recovered. Went for a bit of a run this morning and felt okay. But someone wanted to talk about the spike in children's hospitalizations with COVID and why is this happening? And if you look in the popular press, you're going to see all kinds of news titles like child hospitalization rates hit record highs as Omicron variant becomes prevalent, or COVID hospitalizations among U.S. children soar as schools under pressure. It makes it sound like we're having this unprecedented number of hospitalizations in kids, and it's like it's true, but it lacks context. Okay, so the first thing to remember is there's two kinds of COVID hospitalizations. One is hospitalization with COVID, and then there's hospitalization for COVID. What this means is, let's say that your child is coming into the hospital and was in like had like a neck abscess or something, had some kind of infection, and you bring him to the hospital. They need to get admitted for IV antibiotics, but in the course of all hospital admissions these days, everyone gets tested for COVID. And there's just so much Omicron in the system that a bunch of the kids that are coming in for other reasons have COVID. And then they're listed as having COVID in the hospital. And that happens in adults too, but that is a smaller population of the adults because most of the adults with COVID have symptoms. A lot of the kids with COVID don't have symptoms, so they just don't know. So they're coming in for other things. And so a large proportion of the children that are hospitalized and counted as COVID hospitalizations are hospitalized with COVID, not hospitalized for COVID. Hospitalized for COVID means the kid is sick, having problems breathing or getting fevers, and they bring them to the hospital, and yep, they have COVID, and COVID is what made them sick, and that's why they're in the hospital. So that's hospitalization for COVID. So hospitalization for COVID is a smaller proportion than the hospitalization with COVID in children. And how do we know this? Kind of firsthand knowledge from what's going on in the children's hospital that I work at, and people I talk to. But if you can just go look directly at the data, and what you would think is if there's a lot more kids getting hospitalized with COVID, and it's more dangerous, you would expect that the death rates would go up, that the death rates in the children would go up, but that is not the case. Okay, so I'll show you here. So this is a report that's generated weekly by the American Academy of Pediatrics and the Children's Hospital Association. This was generated, the most recent one was on January 13th, 2022. So let's go through this briefly. So they'll look at cumulative numbers of COVID cases, and you'll see that the largest numbers in California, then Florida, then Illinois. So, and then percentage that are children. So the highest percentage throughout the population. So in Vermont, the largest proportion of COVID patients are children. And in Alabama, it's the lowest. And then on a per population basis, the highest rates are in Rhode Island, Alaska, West Virginia, and Delaware. Okay, and the lowest rates are in like Oregon, I'm guessing that's Guam, Nebraska, and Alabama. So California looked high, but California is actually, where is it? Like kind of on the lower end here, on a per population basis. California just has a big population. Okay, so let's look at what's going on. This is the number of pediatric cases added over time. And here's the last winter spike. And see, look at the Omicron spike. It is huge. So partially there's more hospitalizations because there's just more people overall getting it. Not just kids, adults, kids, everyone. Okay? And look at this number of COVID cases for children and adults. See? The light blue is adults and the dark blue is children. And so just everyone's getting it. It's not anything special. It's not especially attacking kids, and it's not especially more dangerous to kids. And the way we know that is, if we scroll down here, this shows mortality. Okay, so let's look at this. When the pandemic, when we first started getting recording data, it was 2020. Pediatric case mortality was 0.6%. Then, as you see, as we get better, as we start doing more testing, so the denominator is bigger, and also we just get better at treating it, it goes down to 0.02, and then it stabilizes at 0.01. So 0.01% of testable cases end up as death. And 0.01 is as low as it gets. It's probably like 0.00, it's probably even less, but they're just taking out the two decimal places, so it ends up as 0.01. It's very, very few. Since the pandemic started in America, we've had a total of 762 deaths total. Whereas, deaths amongst adults are in the hundreds of thousands. So this is 762 deaths. And you can see since Omicron started, how many deaths have we had? About 40 deaths. And of course, one child death is one too many. But in the when you look at the total numbers of cases, that's an extremely low percentage. And you don't see this percentage spiking up as Omicron hit. And so, yes, his total deaths in America, all ages, is reaching 800,000. So children deaths are very, very low. If you look at the CDC data, what you'll see here is in all age groups, look at the number of cases. All age groups spiked. And if you look here, in children, it's about 1 in 100 kids have it at the peak of the spike. So about 1% of if you had 100 kids, chances are one of them has it. And then if you look at deaths, look at all age groups right here. What you'll see here, and let's see, I'll make this a little smaller. There we go. This dark purple group is the 75 and older group. They're the ones who are dying at the highest rate. And then you see the Omicron spike happened here. There's almost no associated spike in death, even in the elderly. And look at this, the yellow dotted lines, the yellow are the children. The yellow don't even show up. They're right at zero. They're just riding zero. The number of deaths is so small that they don't even rise above zero. Okay? So this is true. Hospitalizations are up, but they're up because of two reasons. There's just a lot of infection out there. It's higher than it's ever been, just overall. The cases are just high. They're just spiking. So it's high for everyone. It's not especially for kids. It's high for everyone. And two, a lot of the hospitalizations are hospitalizations with COVID, not hospitalizations for COVID. And in terms of how dangerous it is, it has not changed. Death rates are still less than 0.01%. Okay, so I hope that clears things up. Omicron is not especially dangerous for kids. It's more likely less dangerous for kids than the previous variants.